and they say this many percentage of people got benefit from it, so everybody they will prescribe. So it's not individualized. That's the difference. But more of it from it is all of us have to go back where we were raised. And what were our grandmothers cooked? And what did they give it to us? The vegetables were local in the areas, and Dr. Gupta can tell you a lot of those are, people have the constitutions in certain areas. In the south they use a lot more coconut oil. Yeah. It's a hot country. In the north they use a lot more ghee in there. Is that? So it's with us. As he said, we are all raised with it. We have just forgotten it. Yeah. And we have that. So it's all of us can change that. The second thing is we are a generation of McDonald's. We want instant cures. Yeah. We want a medicine to cure us. We have no time for sickness. And whatever Ayurvedic medicine, it's a lot more time-consuming, life-changing. You have to work at it. And there are not many people who are ready to do that. So those are the two things. So I think we are all seniors. We have a lot of time at our hands. And we can make life changes and follow some of the recommendation there. So basic thing is know yourself. Know what kind of food is good for you, your body tells you, which is not good, and have some principles of exercise, breathing, all those things. And to tell you, it's a very time consuming to change yourself. But now, any more questions?
Yeah, I will come to you first.
Back in India, I had a couple of sort of issues. First of all, I'll tell you the good story, and then I'll tell you the other part. The good story is that when I was a kid, maybe 17, 14, 13 years of age, I had a big problem of chapaki, urticaria, that kind of thing. And I would take those, in India, the Avil tablets, no anti-allergy, and sort of, and they're working sometimes, sometimes not working. And I suddenly, going in this, I had this Ayurvedic thing, and he saying, in the old Indian fashion, chapaki ka satya ilaj, that kind of thing. So I had no trust in those things, but still, what the heck, what am I going to lose? It's not, Avil is not doing much anyway. So I went to them, and he gave me those puriyas, 28 puriyas, and take one every day, and I did, and it took care of my, that was a good story. The other problem I have, with Ayurveda is twofold. One is, if you have a problem in India, and my experience is based on India, you go to 3 Ayurvedic practitioners, the chances are that all 3 are going to give you the same symptoms, or the same person, but you're going to get 3 different type of prescriptions from them. Whereas you go to 3 sort of standard allopathic doctors, they're going to get the same, describe the same symptoms, you get the same medication. So non-standardization, that's one problem. And this is not just those who are hereditary, even those who have gone to Ayurvedic colleges will apply to that also. The second thing is a question. Why haven't the Ayurvedic research institutes in India, who are heavily supported by the government, all kind of funding is available, do this kind of double-blind clinical tests, controlled blind tests, to see what is effective, what is not effective?
You mean of the kind that the FDA requires to certify?
That's right, yeah.
Okay. So you had one bad story and one good story. I have 2 good stories. The good story is my personal experience with urticaria. This is when I was doing my undergraduate degree in Ayurveda. I had that. And I had Avil, which is antihistamine, in my pocket. And as soon as I see this is coming, I will take that. I was not happy, but I did not have a solution. I saw my teachers, and still it didn't go away. So eventually, now how did it go away? And this is another very significant part of Ayurveda. It removes the cause. If I have something manifesting here, I just apply here, it's not taking care of the root cause. So root cause in my case was accumulation of some heating toxins that were trapped. And so they were not out of the body, so then they will pop up from the skin in form of urticaria. What worked? One of my teachers said, no, even Ayurvedic herbs will take care of the problem, uproot the problem until you do the cleanse. He gave me a cleanse. Cleanse means he gave me some medicine. I purged, and then I took the medicine. This happened in 1986. I never had that problem. I was taking Avil. I saw the top allopathic doctors, and they checked for the worms and this and that, and it didn't help. I did the purge, and then I took the medicine only for 1 month, completely uprooted. So I have the same experience. Coming to research. Fortunately now, India is taking the lead role in doing research on Ayurveda and taking the main problems like diabetes. There is a department in India, and actually you might have heard that now Indian government has created its own Ayurveda ministry. And it is funded properly, and the research products are taken, and on diabetes they are working. They have found a product for psoriasis that works. They have found a product for malaria that works. Like that, and there are CCRAS, Central Council of Research in Ayurveda and Siddha. There are those branches all across India. It's just a matter of government taking seriously. And I can tell you, I'm actually very positive about that, because I was also not very happy. But now that research, double-blind study, that will be accepted. Not only that, Indian government is also appointing Ayurvedic doctor in the countries in collaboration with the university. They will be funding for that doctor to be there, and they will collaborate with the university and do the research. So all of that is happening. So many positive things are happening.
There was a question at the back.
Yeah.
And we have to make that the last one.
Yeah.
Well, if there is no time, basically my question is how Ayurveda is doing when it comes to curing. I know what you told, you do keep on following it all through your life, and then chances are, or it happens that you won't be sick. But it still happens, we do get sick. As probably she was saying, it is time consuming. When it comes to cure, and if it is serious enough, a disease, how Ayurveda will help?
Good question. Now I have to tell you that any medicine has its limitation. But there are still some advantages and some disadvantages. Say if I have started having acid stomach, just started few weeks ago, I can guarantee it can be cured. But if some problem has gone for years, and it has caused these structural changes, say in the bones, or say in the muscles, once the structural changes have happened, even Ayurveda has limitation. Now coming back to, still, has Ayurveda any better help than other things have? Yes. Ayurveda has many things that can, even cancer patients, where you take the cancer medicine, the side effects sometimes are worse than the symptoms. But Ayurveda can be incorporated. It will not claim ever that it will treat cancer, but it can change the quality of life. So Ayurveda can be intervened despite having its limitations in many cases. And telling you about the time consuming depends upon where we start. I can tell you, when I was studying, I was having all the time sinus problems, and I was taking the things even from Ayurveda. I changed the lifestyle. Now I live it. I don't have sinus problem anymore, and I don't feel that I'm consuming my time, because I eat that way. Once it becomes part of your life, it's not even a question. It's just becomes part. The time is when you have to do cooking. So if you cannot do that, and you are dependent on fast foods, and you are not ready to make those changes, that's a different story. But I can tell you that some changes are so simple. You are drinking cold water, and you start drinking hot water. It's not time consuming. You start drinking some herbal tea, it's not time consuming. You avoid eating something, that's not time consuming. The cooking part is time consuming. And then I recommend in my practice, realizing that it takes time, so I have most of my clients are Canadians, I give them some methods, like using the thermos. And in 5 minutes, all they have to do is preparation time, which is 5 minutes. You don't have to spend time for cooking because the thermos cooks it for you. And then they are eating much healthier than the fast foods in the restaurants. So there are ways to incorporate Ayurveda without fear of it being time consuming. And I will still encourage strongly take benefit of this ancient medicine, very much relevant in modern time, not to be afraid that it will take you time.
I'm going to say, every segment of medicine, whether it's Ayurvedic, homeopathy or anything, have a significant advantage for people. What it's needed is allopathic medicine is much more effective in acute situations, whereas the Ayurvedic is much more in chronic prevention and chronic. So when you try to combine both, when you try to see where it will help you more, that is what will work for you. One is not substitute for other. But the question is, where one medicine is not giving you what you need to be healthy and functional, the other is willing to give you that. I mean, you have appendicitis, you're not going to do Ayurvedic medicine, you're going to get surgery. So that is the choice. It's not comparison of apple and apple. It's like apple and oranges, and you combine them together to get the best benefit out of it. And we are lucky, we are born in India. We have knowledge which we have absorbed in growing up about the foods and the cooking and the thing, and we can make it as advantage.
Ladies and gentlemen, it's 3:30. I'm
Yeah.
afraid we'll have to cut it off.
And don't fill the evaluation forms,
We
please.
have to take the college for, there'll be a short vote of thanks, and then please, take some pizza,
On behalf of the Shantari and everybody present here, thank you very much, Dr. Gupta, for the presentation.